Calling the meeting to order of the March 8th, 2023 Monterey County Emergency Medical Services Agency Emergency Medical Care Committee meeting. We're going to go ahead and before we get going with introductions and roll call, I'm just going to let everybody know that we're going to be moving was item E. New business. Item in new business, item E, we're going to be moving that up to the top right after public comment. So with that, Steve, we'll get a roll call and confirm quorum.
Yes, very good. All right, Will Hiller. Here. Tina Nieto. Sam Klemick.
Here.
Very good. Jim Lamborg.
Here.
Harry Robbins.
Here.
Jody Schaefer.
Here.
Luis Garcia. Paul Wood. Dick Greenson.
Here, I apologize in advance. I do have to leave at 11:30.
Carla Spencer.
Here.
Thank you. John Anthony.
Here.
Very good. Have a quorum for members real quick. Ex officio members, Teresa Rios.
Here.
That's here. Tracy Molfino. Leanne Migoski. Alternate members, let's see. Cheryl Getz, not in the room. Joe Faro, Dave Smith. Any alternate members would like to announce their presence? All right. Then we'll go around the room for those who are not members and have already introduced themselves. We'll start. Let's see. Let's go over there. If you choose to, you do not have to. Scott Houchin, thank you.
Flores Salmon.
Morning, Jeff Warner with CalStar.
Sam Ballesteri, retired EMT.
Blake Anderson with the EMS agency.
Jesse Aller with the EMS agency.
Oh, sorry, Deborah Hopker with the EMS agency.
Steve Brooks, EMS Agency.
John Brawley, EMS agency.
Thank you.
Okay, all right. We're gonna jump forward to in new business, item E. This is gonna be a report by Susan. So Susan, if you're ready to go on that, we're.
Sure. Can everyone hear me?
Yes.
All right. I am not a panelist, so I can't share my screen for the PowerPoint if somebody else can do that.
You're right now, Susan.
Awesome. As everyone knows, the governor's emergency COVID order ended at the end of February. So at this point, everyone must appear in person for committee meetings. AB 361 was only in effect while the governor's order related to COVID measures was in effect. Before I go into new legislation called AB 2449, I will encourage people that want to attend a meeting remotely to use the old Brown Act teleconference requirements, which basically what you have to do is agendize that you're going to appear remotely and put the address of the location that you're appearing remotely on the agenda. So frankly, this is not ideal for individual public members, but for first responders, you could simply put the address of your office on the agenda. Each location must be accessible to the public. Are the public going to actually come to the fire station? I doubt it, but it technically has to be accessible to the public. And all votes must be by roll call. Next slide. We are discouraging folks to stay away from the new legislation under AB 2449 just because it's extraordinarily convoluted and complicated. That doesn't mean you can't appear that way. But if you know that you need to appear remotely pursuant to AB 2449, I encourage you all to reach out to me and I will assist in the process to do that. I will tell you that there is new legislation that is designed to simplify and go back to the more of the AB 361 requirements, but that has a long way to go before it's passed, if it's going to be passed. But AB 2449 basically allows people to appear telephonically, but it has to be visually and telephonically. So it has to be like by Zoom or Microsoft Teams. And if that person's internet gets disrupted, you have to cease the meeting. You have to stop the meeting. And the person appearing remotely has to identify anyone 18 years or older that's in the room with them at the time of that they're making the appearance. Go ahead, next slide. This can't be used a lot under AB 2449. There's a limit of 3 consecutive months or 20% of all meetings. Whereas the traditional Brown Act teleconference appearance, there's no such limitation. There are 2 different ways you can do it: just cause and emergency circumstances. Go ahead to the next slide. Under just cause, you simply have to notify the committee as soon as possible, up to the start of the meeting. And there has to be a reason that you're appearing remotely, such as care of a child, you have a cold, you have COVID, etc. The board or the committee does not have to vote on the just cause exception, but you can only use the just cause exception twice per calendar year. So if people start using AB 2449, somebody has to track their appearances. Go ahead to the next slide. The emergency circumstances, a member must notify the committee as soon as possible with a general description as to what the emergency is. The committee has to vote on the emergency circumstances exception and vote that it is actually an emergency approved under AB 2449. Go ahead to the next. For using AB 2449, there must always be a quorum of people physically located in the same location, which would be, shilling in our circumstances. So you can't have, it's only for a couple of committee members at a time. You still have to have a quorum in person. And again, just as a summary, we're encouraging people to use the traditional Brown Act teleconferencing just because of the onerous requirements under AB 2449. And with that, I'm happy to answer any questions.
Questions? Actually, Susan, I have one, and I know that you recommend using the Brown Act, but just out of interest, you said in there that it required committee approval. So is that something that is done in the beginning of the meeting, like after roll call, or?
Yes, so the just cause exception doesn't require committee approval. The emergency section does, which I don't understand why, but that's the way the law is written. So the emergency situation, ideally you put it on the agenda, but if you don't have time, it can be added as an urgency item and you would handle it immediately, because obviously if the committee chose not to approve that emergency exception, the person trying to attend remotely would not be allowed to attend.
Thank you.
It's a convoluted mess, but I'm here to help if such a situation comes up.
Well, Susan, Steve here. Because this is now potentially an issue, if a member of the committee were to be unable to attend in person, but chose to show up remotely, but we hadn't noticed it, such as required under the Brown Act, we could use these exemptions, if you will, or opportunities through AB 2449. But if not, I'm assuming that the member would then not be considered present for voting purposes.
Correct,
Okay.
correct. So you could use the just cause, doesn't necessarily have to be agendized. You just have to announce at the beginning that you are appearing remotely under AB 2449 because of one of the reasons enumerated in the statute. You have to take care of a child with a cold, or you're sick, or that kind of thing. But you are correct, they would not be able to vote if it does not satisfy the requirements of AB 2449. The staff can still, as I'm appearing by Zoom today, I'm not a voting member, so staff can still appear remotely. It's just the actual voting committee members.
Thank you.
Is this slideshow available for distribution so we could have the rules?
Sure. Yes, it's Steve can email it to you. It's public.
And it is in the agenda.
Thank you.
All right.
Any other questions or comments? Seeing none, we'll move on to item 2, public comment.
Thanks.
Yes.
How is the county proceeding with a new RFP at this time?
As part of the updates, if you don't mind, we can provide the update at the time.
Any other questions or comments? Okay, seeing none.
I
we'll
still
move on.
don't understand all these rules for our non-binding votes. Right, I mean, look, right, I mean, so to be a voting member, you need to be here in person, everything like that, but the votes aren't binding anyway, so what? It still this still does not make sense to me, what she's describing from a legal standpoint.
You're fine.
We understand the frustration.
I mean, like,
We need to play by the rules, so
I mean,
we were given the chance to make the rules, and definitely that would be different.
but I don't get, I mean, if the votes aren't binding anyway, then why do we have to comply with all these rules? Because they don't have any legal standing, right? I mean, that's what you guys tell me when we disagree, right? Over the past decade,
Simply put,
you know.
quote, Pogo, we have met the enemy, and it is us.
Okay, any other comments? Very good. Moving on to item 3, approval of past EMC meeting minutes. We have a motion for the January 11th EMCC meeting minutes.
I move approval of both minutes.
Very good. We have a second. Second. And All in favor, say aye.
Well,
Oh, we need to do a roll call? Okay, we'll do a roll call.
sorry, it's a Brown Act requirement.
Votes here. I'll go with you.
Right, non-binding votes. They can be all-
I'm just trying to move past that.
All right, Will Hiller.
Aye.
Jim Langborg,
Here,
Harry
or yes, aye.
Harry Robbins,
Aye.
Jody Schaefer, Nick Greenson,
Aye.
Carla Spencer,
Aye.
John Anthony.
Aye.
B, February 8th, EMCC special meeting minutes.
The motion was
I
to
move
include
motion to
both.
vote. I move motion to
Oh,
vote.
very good. Excellent. Moving on to reports then. We'll move on to the Medical Advisory Subcommittee.
And unless there's questions, that's in the packet. And
Anything from Jesse on that or, you know?
it's it's just in the packet. If there's questions, we can answer them.
Okay, excellent. Moving on to the Operations Subcommittee. Same or do we have?
Like, did everything, Sam, QI?
Yeah, I can present a PI. Give me one moment, everybody. Good morning, everybody. Just a quick update for our CQI, and sorry, my computer literally just closed its screen as I was walking up here. I will give our CQI tag update. There is a report in your packet. So rather than going through all of it over and over again, just some brief updates on, we were able to hold our first T-Quick meeting for the first time in about a year. That was helpful for us. And we were able to get good feedback from our stakeholders like Michelle Kalinsky. She provided a lot of feedback, especially on the topic of pediatric patient triage. But during that time, this meeting, we, as the agency, presented our policy and protocol review cycles and where the agency stands at this point and where we're moving forward from. We also presented on core measures and recent recommendations by trauma triage. Dr. Burley was able to give a very descriptive response on some of the new guidelines that are recommended for trauma triage. And we also presented multiple reports for the year 2022. In our CQI tag, we were able to hold on February 22nd. It started off with Dr. Burley and I presenting on our high performance CPR initiative and stating where we are and also the origins of kind of the high performance CPR was starting with the Resuscitation Academy and data that we saw from there and how we would like to apply some of their practices into our system, where we were at. And also we presented that we had also had the chance to meet with stakeholders, particularly AMR and Monterey Regional, being our primary EMS ambulance providers. And our next steps will be to reach out to more of our agencies, the EMS service providers and the hospitals to get their input on this. And we're looking forward to what gets presented at for our new high performance CPR initiative. There was also a very fruitful discussion on patient restraints. During this meeting, AMR had brought up with recent incidences of EMS crews being potentially verbally or physically assaulted while transporting, and looking at some of the policies on addressing any confusions, the EMS agency was able to state its interpretation of policies. And we're going to continue working with a lot of our stakeholders on this further language of the policies and making sure that everyone, all of our agencies feel empowered with what is written in their policies for the restraint policies. We also presented on QI plans, and during that QI plan presentation, we discussed deadlines such as when QI plans are due, what is required of them. And we made the offer to all of our stakeholders, reach out to us if you need any assistance on your QI plans or updates. So far, we've actually had multiple agencies reach out to us, and we've been able to assist them and explaining kind of what's expected of them by the state, what's set up by EMSA, and what the materials required. And we've also provided sample QI plans for our agency, so they have an idea of what to look at and kind of mirror. And then for those, and then what the EMS agency ourselves is looking for on these plans. The deadline for those is May 30th, and if we will continue to work with some of the agencies, our hospital providers and the EMS service providers on those plans. And outside of that, there are continuing education opportunities that the EMS agency wants stakeholders to take advantage of. And also in our report, we have the upcoming meeting dates for STEMI, QI, TQuick, CQI tag, and stroke QI. Anyone have any questions at this time?
Thank you.
Thank you.
EMS Agency Director Report, Teresa.
Good, Chief. In your packets, there was a report on some of the projects that the agency has been working on. So I won't go into detail about that, except for the last item, which had to do with the RFP, and you just asked about it. There isn't a very formal report, other than to say that the informal process of the RFP, we've been working on it. We are looking at incorporating the different pieces, changes that have been made to the system that can work into the new design of the system, if you will. Establishing our timeline for the RFP, scheduling meetings so that we can seek the input from our stakeholders. Trying to revisit the lessons learned from the past processes where very formal interviews were conducted by a consultant to develop the strategic plan, to assist the system and develop the strategic plan, and still sort of the shortcomings of that in the system, some stakeholders feeling like that there wasn't enough opportunity. So trying to revisit that and how to correct that, how to better have that dialogue with our stakeholders at the same time that we are being protective of the process, because this is a heavily regulated process by the state. So we want to make sure that we are ensuring that we are in compliance with the state's requirements, but also meeting the needs for how we get that input from our stakeholders. At the next meeting in May, we'll probably have a more formal report to be able to provide, and the schedule of how the RFP is gonna take.
Can you give a real general timeline for how you see that playing out?
Let me see if I can work this backwards in my head. So the current contract is it will expire June 30th of 2025.
Okay.
Normally, what we look for is to be able to award the contract a year before that, just to give us some leg room here if there's some hiccups there. Then about 4 months prior to that is the RFP process. That's formal from the time that it is released to the time that a review panel recommends the award, and then it goes to the Board of Supervisors.
Okay, so that process will play out like towards the end of this year is what you're.
No, next year.
Next year.
Yes.
Okay.
Yeah, and then prior to that, before the RFP is released for companies to bid, it has to go to the state for approval.
Okay.
The state, we're trying to gauge how long the state can take with that approval, but they can take months.
And when would we see the RFP?
This summer.
This summer, okay.
That's the goal.
You anticipate in all probability that the time frame will be similar to what we dealt with last time?
Yes.
just a comment that's coming up fast.
Yes, yes.
And,
It always does.
so, yeah, I think it's a good idea.
Time evaporates fast in this process.
Yeah, as we found out in the last two ones.
Yes.
Okay, thank you. Anything else? Any other questions for Teresa? Appreciate that. Okay, Mark, just going with what's in the, okay.
Just
very
a
good.
presentation.
Any questions on that or?
I got
He's got a
quick thing,
presentation.
Chief.
Oh,
Okay. I'm here to talk about the RFP. No, I'm just kidding. It's that quick. It'll be that quick. So Deborah is primarily the Mohawk within the EMS agency, but with the addition of Blake and I, we were able to add a little bit of depth to the Mohawk program. So you'll see my name also pop in the mix as well as Kimberly. It's definitely a program, so it's not just one person. Primarily staff our EMS agency folks. There's been kind of a handful of updates since our last report in January. Primarily the 2002/3 winter storm event. As you can see on this slide, the Mohawk functions within the EOC. So typically when the EOC is activated, the Mohawk gets activated within the Med Health branch in the ops section within the EOC. And so we report, the Mohawk program reports to the ops section. The county EOC was activated on January 3rd, and the state SOC was activated just before the first of the year. Next slide. We set a handful of objectives throughout the incident. And these were evolving. We were activated for a good, several weeks, 2 to 3 weeks. But of course, we want to ensure the integrity of the 911 system. But 2 areas that we really focused on was one, when the peninsula was threatened to become an island, we put a lot of planning efforts and coordination into what that would look like, specifically giving guidance to EMS providers to be able to manage those patients or be able to get to work. The other thing we worked on was Highway 1 road closures. This was really impacting the Big Sur communities. And so a shout out to Chief Harris and some of his team for doing a great job down there. We were able to come up with some guidance for some of that community down there, which is good to have. And then also the Mohawk supports both temporary evacuation points and emergency shelters, med health aspect wise with equipment, or helping with staffing of personnel as needed. And so we monitor those. Next slide. Or next. Yes, thank you. And we did talk a little bit about kind of this planning, and that was, these are this EMS plan and this EMS preparation guidance for Highway 1. These are, I think, 2 good plans that we could pull off the shelf if this ever happens again. I think we didn't develop this in silo. It definitely took a lot of participation and collaboration from some of the system stakeholders. And I think a lot of great work and some good philosophies came out of those both. Next slide. Of course, communication is key. We tried to communicate as often and as accurately as possible throughout the incident, internally and externally. We send sit reps to the state quite a bit. We send flash reports to the state quite a bit. And then we use ReadyNet to poll and communicate with some of our med health providers. And of course, all of these agencies, they're not listed, but the collaboration was really neat to see unfold. Next slide. And again, here's just an example of a flash report that we're mandated by Title 22 to send certain communications to the region. And one of those is via flash report. These get sent up all the way to the SOC and OES. And so at the state level, conversations occur about our county from the information that you guys provide. And that is, eyes do look at that quite a bit. Our county and Santa Cruz, I would say, we're primarily impacted more than any of the Region 2 counties. So there's a lot of effort dispensed and focus on us. Next slide. This picture here was just that EMS preparation response. This was again for that isolation to the peninsula. And then the other was just guidance that we put together for Highway 1 closures. If you'd like to see any of these, or if you haven't seen them, or if you participated in the development of this, number one, thank you. If you'd like to get a copy and you don't have it, I'd be happy to send it to you. Next slide. There are always, I think, good key takeaways from any incident, things that went well, and certainly things that we could do better. If you have thoughts of things that went well or things that you can improve on, either from your facility or provider agency standpoint, or feedback for the Mohawk program, we'd love to hear about it. We're not going to formally do any sort of after action outside of the EOC folks. We'd like to partner with them. So you may see some formal after action, but if there's comments or things you saw that again went well or could go better, we'd love to hear about it. Next slide. And then kind of on behalf of the county, there was a really nice public service announcement that went out. And so this was in the agenda packet as well. And so there's a video just of us thanking some of the provider agencies who came together in response to the community. It was really neat to see, and I was privileged to be a part of it. Next slide. And with that, I'll take any questions you may have on the Mohawk program or this response.
Has there been any consideration given to the evacuation of Chomp in the event of a water outage?
We kind of, by philosophy, we do that as a last case scenario. To evacuate a acute facility would be a huge undertaking. And so I think the decision either to shelter in place or to help decompress that facility as needed, I think that's always a worthwhile conversation. But that didn't come up out of this incident in particularly.
I suggest you put in your hat for planning, because Chomp was very nearly evacuated back, I think, forget which year it was either 97 or 95, when we lost the water main that runs through the little small arroyo north of Carmel. I was emergency services manager at the time. It's something we had to deal with. Unexpected, and what you're telling me is no, it has not been considered. Shelter in place was not an option when you have no water.
Okay, I appreciate that. I know the state did a water disaster drill several years ago.
Well, it was a question. We lost all fire mains to Pacific Grove, parts of Monterey, lost all water to Chomp. And we were in the verge of evacuating Chomp.
And Jesse, I will add, back in April, before you started, so you wouldn't have been aware of it, there was a local drill that emphasized evacuation, and Chomp was the focus of that. So kind of combined some of the shelter in place as well as evacuation things. So scenario was a little different. It was wildfire related, but it did give a chance to at least start to discuss some of those plans and concepts.
The name of the game is the one that's going to get you is the one you don't expect.
Great point. Appreciate that. Thank you.
Very good. Moving on to number 5, EMS system performance metrics, communications testing.
Okay. Good morning. So I'm going to take A, B, and C because those are all under me. First, communications testing, 800 megahertz and ReadyNet. For the most part for December and January, it was pretty status quo on compliance. There was a dip in percentage in ReadyNet at SVMH. I did reach out to them. They said there was some staff turnover at the ER and that training was an issue. So they were training their personnel better on ReadyNet, the new people that came in. And then in January, their percentage came back up. So any questions on 800 megahertz or ReadyNet before I move on to the next? Okay. Contract compliance, AMR response time performance. There was a PowerPoint in your agenda packet, and all reportable priorities within each zone exceeded, not just met, but exceeded 90% compliance, which is great. And for MPDS, December had the highest percentage of calls indeed so far, which was at 76%. So that's really impressive, and they're doing really good on that. Any questions on contract compliance? Okay. And then C is the fire-based transport provider report, which is also included in your agenda packet. That goes over responses by ambulance, by Carmel, by the C Fire ambulance, and Monterey County Regional Fire. Any questions on that report?
I don't have a question. I just have a comment to the general EMCC over the last 2 years or year and a half or whatever it is. I want to put out kudos specifically to Kimberly and the EMS agency and AMR as they respond to how the data has been reported and made upgrades. I feel like they have done an outstanding job of moving forward and making the data useful.
I'd like to echo that. They've identified problems and they've actively pursued solutions and implemented those solutions. And I totally agree with what Jody has said. We've seen a trend upwards. The MPDS, that has been a steady climb across the last couple of years since it's implemented. I think all hands deserve kudos for that one.
Thank you. All right, thank you.
Okay, moving on to old business, EMCC membership. Steve.
Take me longer to get up here, I think, to do the report. So in your packet, we have the staff report, talks about the EMCC membership, which members' terms are expiring this year. MS Agency will be reaching out to the committee members to help facilitate the application process because the board does want a completed application, a brief bio, as well as we will need to reach out to your recommending organization to obtain the official letter saying that they would like you to represent the committee. So the MS Agency will be doing that for both the member and the alternate. Alternates expire in conjunction with the member in the EMCC position.
What was the date of those expirations?
The dates are June 30th. So at the next meeting, we'll be having all the info to you and have started the process. And more likely the next meeting will be the nudge to, hey, we need the stuff from you because let's face it, you're going to expire, within less than 60 days.
May I jump in? Because the members of this committee are appointed by the board, we need to take each nomination to the Board of Supervisors. For us to get an item on the board's agenda, it can take us good 4 weeks. So that's why we start the process now, and we make it consistent for all the committees, just because it's easier that way. But most important for EMCC, and then because EMCCs are board appointed members, there are additional requirements that have to be met, one of which Steve is going to talk about. But the most important thing for us, for you to complete once you are appointed by the board and you receive that letter from the clerk of the board saying you've been appointed, is usually followed with 3 copies of the oath of office. It has to be notarized. If you go to the clerk of the board downtown, they'll do that for free, but you can take it to any notary. But for us, it's very important that we get that oath of office, notarized oath of office, administered oath of office in our office so that you can be officially seated on the committee. Otherwise, you would not be able to vote on items that are before the committee. And there's also the requirement for there's 2 other requirements. There's I think a sexual harassment prevention training, and then there's ethics training that are also due every 2 years. So we try to, help along the way by notifying you when those are up, but you're helping in just completing those. We try not to make it too difficult where we used to ask for you to send us the certificates, but we move them away from that. It's just let us know that you did it, and a way easier for you, easier for us as well. And then Steve, go ahead with the rest of your.
So there are another requirement, as Teresa was mentioning, the Form 700. Don't wait for reappointment. That is a requirement due by, I believe it's April 1st for each member to complete Form 700. If you've done Form 700 previously, it's very simple unless you've changed your economic status as it relates to things in Monterey County. It's very much just a matter of, yes, this is current, this is current, this is current, done. EMS agency staff have to do it also. That's why I can tell you, if it's very simple if you've done it before. If you need help with it, contact us. We'll help you with the process. Then finally, participation at EMCC. We have some open positions that we are actively looking to fill. We're also looking to fill alternate positions, especially for citizen reps. And we're trying to truly do this based on diverse viewpoint. So people from South County, Peninsula, Salinas, we're looking to truly make sure we've got the diversity that makes this a richer committee. So with that, are there any questions related to EMCC membership?
I have one, Steve. So I saw that Sam was up, correct?
Yes.
Came look for ALS fire. So from fire chiefs or fire agency perspective, just for process, we can get a letter of recommendation to, for instance, to continue him. Can that just go straight to you, or does that need to come to the board?
It goes to us, and then
Okay.
it's part of the packet that we put together along with the application and the bio. We'll send that to the board. So yeah, send it to us.
Okay, very good. Thank you.
Perfect. Thank you. Good question. Any other questions? Thank you very much.
Okay, moving on to new business. Medical Advisory Subcommittee, Jesse, are we? Oh, I'm, gee, I moved my.
We're under.
Someone get me some coffee.
Well, it's right over there.
Gallon Costco size. Okay.
We are B in round 4.
Okay, on to Monterey County Emergency Medical Services Ordinance Revision. Deborah.
All right, good morning, everybody. So we are continuing to work with county council to draft language for the update to the ordinance. So our goals are to address AB 389 as well as other changes that have occurred with the EMS system since the time the ordinance was last worked on. So and the goal also remains to have this process completed by the end of the summer. So by the May EMCC meeting, we should have a larger update for you, but it is still in progress. Happy to answer any questions on that.
Item C, Fort Hunter Liggett.
All right, so we are happy to announce that the agreement between the EMS agency and Fort Hunter Liggett was approved last Tuesday, February 28th. So it's been approved by the Board of Supervisors. We are currently awaiting the board order, and then it will circulate for signatures once that's in our possession. So once that's in place, we'll be able to get a fully executed copy over to Fort Hunter Liggett. So
Are there any significant changes in any of the coverage there?
there's no significant changes. It will continue to allow them to provide mutual aid in the South County area. The largest changes are related to their scope of practice. So they've moved to military-based protocols and military-based medical directions. So in the trauma setting in particular, it provides them with access to several different medications and new procedures that they weren't currently doing and are outside of both Monterey County and the state scope of practice for paramedics.
Yeah, we're moving on to new business. Medical Advisory Subcommittee. Jesse.
This might be a standing item on the EMCC. The MAC is trying very hard to fill all of our primary and alternate vacancies. We have 3 that we're bringing to you today. One recommended from the fire chiefs is Chief Reyes, Justin Reyes. He has been recommended to fill that primary first responder ALS spot. And then the other 2 are in your packet as well. Chelsea from Natividad and David from Salinas Valley, both as alternates and both work in the capacity of RN. So we're just looking for a motion to, okay.
I'd like to move that we approve them and also skip down to item B and get Justin's endorsement for operations all at once.
I'll second that.
A roll call.
Thank you very much.
All right, on the motion to approve the membership or endorsed membership of Justin Reyes, Chelsea Mettler, David Thompson, and Justin Reyes for EMS Ops. That's as I understand the motion. All right, roll call. Will Hiller.
Aye.
Sam Clemic.
Aye.
Jim Lamborg.
Aye.
Harry Robbins.
Aye.
Jody Schaefer.
Aye.
Paul, let's see, Dr. Nick Greenson.
Aye.
Carlos Spencer.
Aye.
John Anthony.
Aye.
Very good. Item C, EMCC annual report to the board. Lisa.
Thank you, Chief. I've mentioned in the past that the EMS agency is looking, reviewing all of the requirements, all of our obligations as a lead agency, looking at all our internal processes and revising as needed. One of the things that came up recently is a requirement by both the Board of Supervisors and Health and Safety Code for this body to provide an annual report to the clerk of the board. We searched through our agendas from previous years to see if that had come up as a different item, and maybe somewhere along the lines, it just kind of like faded away. And there isn't a separate report. What we have consistently is the EMS annual report that has been brought to this committee and then to the Board of Supervisors, which leads me to believe that that's probably what was intended to be the EMCC report. But probably because of the title, then it doesn't clearly state that that is what we're trying to do with that report. So what we want to do is recommend two options. One is, and we should have done this sooner, but our annual report should always include a letter from the EMCC. In the work that we do, your work is very important. And so that should have been there. With that, we could definitely ensure the compliance with the requirement of that annual report. That what is expected to be included in a report from the EMCC is all already in the annual report. So I don't know that there's a need to have two reports done. We can work with the chair on just, getting that letter and ensuring that we make a statement on the annual report. I don't like questions. I don't like things that are not clear. So I want to make sure that, if I wasn't clear, if that annual report was that EMCC report, then I know somebody else would have the same question. So I want to spell it out that is the report that is to meet the requirement from the Health and Safety Code. The other option was for this committee to write a separate report. But I know how busy everybody is. So we want to give you those two options. The EMS annual report would come to this committee in May for endorsement before it goes to the Board of Supervisors. So again, I think that we could easily ensure that was the intent and ensure that it is clear moving forward and making sure that there's always, a letter from this body incorporated into the report.
Teresa, that would be a letter of concurrence and endorsement.
It would not be a letter of concurrence and endorsement. It would be, I think the piece that is missing in that report is a letter from this committee just talking more about observations, achievements, and even stating the membership of the committee. So we want to make sure that that is included. But everything else, the progress, the activities of the year is already all spelled out in the report.
More of an executive summary than anything else.
Exactly.
Yeah.
Thank
All
you.
right.
Thank
Yeah.
you.
All right, that's what I'm getting at.
Yes.
Get a better feel for it.
Yeah, more of an executive summary.
And so Teresa, would you be creating a draft for us and then allowing us to edit? Is that what it would look like?
Yes, we could definitely, we're flexible. So we could definitely, because we work on that annual report, we can pick some of the highlights, like I said, work through the chair or with the chair on finalizing that. It would come to, and maybe, I'm not sure, because we get into the, having a meeting, and, when depending on how much communication happens among the members. we gotta be careful about that. But it would come to this committee for endorsement in May.
So would it be possible, I guess, to speak to that point, to possibly get that information before we normally get the board packet? So that, because we typically get the board packet about what, a week in advance or so, which is very good, but to just ensure so that when we do show up for that meeting, because that's really when you're going to be looking for that approval, endorsement, or whatever, that you've ensured that your members have had enough time to view it and.
Yes.
Okay.
And discuss it with their group in particular.
Definitely. We'll do that our best. I don't know if you remember, but the annual report used to go to the board in the month of December.
Right.
We changed it to the month of May to coincide with EMS week. And we've had the opportunity to do a presentation to the Board of Supervisors. So, just trying to figure out the best way to do it. I think that we would have to work internally to whether we can next year when this comes around. This time we'll do our best to meet all the needs. But next year when this comes around, that by this meeting, we can have a draft of the annual report. Okay, you have it, it's been agendized, there's no problem. And then by May, we need to tweak it. We have time to tweak it and revise or give enough time for the chair to work on the executive summary or revise a draft that we can prepare. May comes for endorsement. I think that the timeline would work. It just means we have to work on it much earlier than expected. But it is the goal of the EMS agency for us to be in compliance with every requirement. And, this one came up, so we're bringing it to you.
Draft is a good idea. Gives us something to work with.
And working in government, and I'm not saying that this is what's happening here, but I think it speaks a little bit to what you were just saying. I think by doing that, that ensures that you're not checking the box. And, because there's always the perception that can happen. It's like, oh, here you go. And
yeah, we don't want to bring something to you and just to have it rubber stamped at all. We want to make sure that the sample time is just this year. We just came across this, and this was our first opportunity to bring it to you.
Yes.
I mean, in past years, the annual report has a letter from Teresa and then a letter from myself and then the body of the entire report. And it's usually helpful to sort of have the report first so that we know, okay, remind us what were our accomplishments, what were the challenges, what do we face to the future, so we can sort of comment on that in our letters. But the letters are specific from Teresa's perspective, from my perspective, and ideally would be specific from the perspective of the EMCC and the chair, so that almost, so that it comes from your voice, as opposed to us writing it and just saying, do you approve? In an ideal way, it would come from this body and from the chair in your voice.
thank you.
Thank you.
B, ET3 program review and continuation. Deborah.
So as you may remember, when we originally approved the ET3 program for AMR, we included a 6-month review period and then a meeting to determine whether to continue with the program. So time flew by quickly and we have reached our 6-month period. So we have held the meeting with AMR, discussed the program, and decided to continue with the program as it stands currently. We have been providing regular progress reports and data reports, as well as conducting regular reviews of PCRs associated with the program. The decision has been made to conduct that through our CQI tag meetings, which seems like a very appropriate place for that. So we will continue with those processes and provide our regular updates through that group.
How many patients have you had in the program?
I will.
A handful.
The average is probably like
To go through the entire program and then actually get seen by a physician, less than 10.
So one of our goals with bringing that to the CQI tag is to look for making sure that the program is being used appropriately, but also for opportunities to, if we're missing opportunities, or if there are things that we could be doing better with that program. So that's one of the projects that Blake has recently undertaken working on, and we'll be working closely with AMR to work on those items.
Were there any areas of opportunity in the first round?
So we haven't found any instances where it was used inappropriately, which is great. It's been a very small number, which is exactly what we expected. I think we have some opportunities for education with patients just related to the use of telehealth, their comfort with telehealth, and maybe to develop some materials so that people kind of know a little bit more about the program, and maybe those patients that AMR encounters that decline it, we can, for instance, leave a document behind or something like that that gives them a little bit of information that they can learn about the program when they're not in the midst of an emergency situation. So things like that.
Can we request every year to get a report here? After there's been time for more, and I would be interested not only in our local county, but how it fits in the broader scope of that program.
Just a couple of quick questions. First one is, do you anticipate those numbers to go up? And then I'll follow that with my other questions. You think the numbers are low because the crews that are doing this are reluctant to utilize the system because they're afraid they're going to make a mistake? Or
I think there's probably a combination of both. We're seeing the crews use the system appropriately. We're seeing some hesitancy from patients to accept the offer of the alternate disposition, which is why I think there's that opportunity for some education for patients as far as telehealth. And I think throughout COVID, we've seen the growth of telehealth in general, and people are becoming more comfortable with it, but there's still a huge subset of the population out there that either hasn't used it or isn't comfortable using it. So opportunities for improvement there.
Is it open to all payer, or is it still payer mix dependent?
It's open to all payers.
One of the things that I attended a conference in is it Syracuse, somewhere in New York. They implemented the program and they gave a presentation on ET3, and what we are experiencing seems to be consistent with what other systems are experiencing. They start very, very small, that there's a hesitation on the part of patients to access that service. And so we're looking to see those who have now grown their programs over time, how they were successful. So we're not reinventing the wheel. We really think that educating the user of the program, that is one way for us to make it grow, and then just maybe fine tuning how the crews may be approaching it. We're sitting down with AMR to take a closer look at those things, and then just see what we can take from other systems, in terms of educational materials, or how to approach that education with the patients.
anything covered E already, so we'll move on to announcements and good of the order.
All right, we have two items that have come to our attention. I think we'll get one of them hopefully on the screen here. The county administrative officer, the CAO, is new to the position in Monterey County. Sonia De La Rosa is our new CAO, and she comes to us, I believe, San Joaquin County. But she used to live here, and so this is kind of home for her. So she's returned as our new CAO. So we wanted to let you know that we have the new CAO. Also, in her CAO rundown, she did highlight the work done by the people who respond to disasters. We had a water emergency, and so she thanks all the providers, Department of Emergency Management, and all the people who supported through the EOC. And so we wanted to call out that as part of her CAO rundown, and then highlight, which Jesse did a little bit on the MOAC. The EMS agency was also part of that and supported the disaster response in the county. Second item is recognition by the Board of Supervisors for Mercier, who was recognized for being very involved in the south end of the county. what really brought this seems to be the attention of them, the Board of Supervisors, had to do with their participation in Operation Santa, where they brought Santa into King City back in December. And then they're also being recognized for their program they have to assist people with paying their bills, for those who have difficulty in paying the bill when they've needed the service. So anyways, since the Board of Supervisors recognized them, we thought we should at least let our EMCC know of a piece of the system that is getting recognized outside of our committee. And that's what we have for this announcements.
Any others? Okay, moving on, next meeting, the next meeting will be Wednesday, May 10th, 2023 at 10:30. Imagine in the same room. And with that, I'll take a motion to adjourn.
So move.
Second. All in favor, leave.